5 things I would never do as a fertility doctor. If you're new to my channel, I am Dr. Amarachi Ijeoma. I am a fertility doctor and my channel focuses on everything women's health and fertility. So if this is the kind of content you're interested in, keep watching. 1. I would not use anything that is not water or unscented soap to wash the vulva. And I would not insert anything that I don't know about inside the vagina, especially herbal drugs. Emphasis on the word herbal, traditionally herbal drugs. This practice is very common in Nigeria, and I have seen firsthand the damage it has done to the vagina and the reproductive tract of women. It is very common practice in Nigeria for women to put herbal medications into their vagina in an attempt to treat fibroids, in an attempt to flush out unwanted pregnancies, in an attempt to treat infertility. They believe that these herbal medications will melt the fibroid or would kill all of the bacteria and the bad cells that are causing the infertility, or that it will cause harm to the baby and expel the baby. This practice is really common and it has done so much damage. One of the conditions that this has resulted to is something we call vaginal atresia. In developed countries like the US, UK, and other developed countries, when you see a woman with vaginal atresia, it means she was born with it. So that is the more common causes in developed countries. But in countries, for example, that are not developed like Nigeria, you have more women coming to the clinic with vaginal atresia that is acquired, that is gotten from inserting different kind of things into their vaginas. Most times these things contain caustic soda. What is caustic soda? Most of our cleaners in the house, most of the bleaches that we use to clean hard stain, heavy stain, contains caustic soda. Caustic soda, when you mix it with water, it's corrosive, it burns, it has a violent reaction. And then when you put it on your skin, you're causing injury to your skin, not to talk of the very thin tissue, delicate tissue that is inside your vagina. So when women put these caustic sodas into their vagina, it causes injury to the canal of the vagina, and then when it's healing, it heals together, so it causes a fusion. So it's either a complete narrowing or an incomplete narrowing of the vagina. This makes them complain of pain during sexual intercourse, infertility, because at some point, even if we are able to use a speculum, which is an instrument we use to open up the vagina so we can see the cervix, even when we're able to do that, it's super difficult. It's very difficult. And then we can't even make out the cervix from the vaginal wall. Nothing. Everywhere is just destroyed. So this causes infertility in women. So how do you treat vaginal atresia? Another word for it is gynaectasia. Treatment is achieved through surgery, and surgery is still not 100%. Sometimes it requires multiple surgeries to actually be able to separate completely, because it depends on the extent to which the damage is done. And even after you have separated, most times the woman would require IVF to be able to get pregnant. And even with IVF, remember that the last stage of IVF is transfer of the embryo into the womb of the woman. So how do we transfer when we can barely make out the cervix? We cannot even make out the opening of the cervix. And even when we do, we can't separate like an entrance that is closed up. So this makes transfer during IVF difficult. So most times, even though you have the option to do IVF, we might be telling you, okay, you need to do surrogacy because we need to transfer the embryo into another woman that would carry the baby. Bear in mind that your eggs might not be affected, so you can still get pregnant with your eggs, but you might not necessarily be the person that would carry the pregnancy. So thankfully there is something called surrogacy that we can do. But the important thing to note is that acquired vaginal atresia is preventable. All you need to do is stay away from putting different things into your vagina. Your vagina can clean itself. It cleans itself. That's why you have vaginal discharge. That is your vagina cleaning itself. Your vagina doesn't need you to put any sort of harsh thing inside it. All you need to do is just clean your vulva and move on with your life, because your vagina will take care of herself. 2, I will not ignore my period signs, because Period signs can tell you so many things. If my period suddenly becomes heavier than it used to be, or becomes severely painful that I can't do anything, the pain is unbearable, or it starts coming in between periods, like I've seen my period now, I'm yet to see my period, but I'm seeing it again, or the duration lasts longer than it used to. Maybe before I used to bleed for 4 days and I start to bleed for 7 days or 8 days, I'm not gonna ignore it, because your period is telling you something might be going on with your reproductive organs, some of which can be fibroid, because your period can tell you, oh, you might be having fibroid, or why are you bleeding up to 8 days when you used to bleed just 4 days, or why are you using 8 pads today when on a normal day you use just 3 pads. So pay attention to what your period is telling you. Or you previously used to see your period every month, all of a sudden you're seeing it only 3 times in a year. It could be telling you that maybe I have PCOS, maybe something is going on. Don't ignore the sign. Number 3, I will not smoke, because smoking can actually cause the amount of eggs in your ovaries to finish faster. It can also cause abnormalities of your eggs that has been associated with miscarriages in women that smoke. And it can cause you to reach menopause earlier than you're supposed to. So I will stay away from smoking. I will stay away very far from tretinoin, any retinol, any vitamin A derivative when I am actively trying to get pregnant. Let's face it, tretinoin is amazing. It's a major breakthrough in skincare. I mean, it causes your skin to be glowing, very beautiful. It treats acne. It's an amazing medication. It comes in tablets, but it's more popularly in the cream form that you apply daily on your face, of course, with your sunscreen. You know, it's a really good skincare product. But one thing that you should know about tretinoin is that it can affect your baby. So if you are actively trying to get pregnant and you're on tretinoin and you get pregnant, it could cause major birth defects in your baby. So in some countries like the US, tretinoin is regulated. What do I mean? You cannot just walk into your local pharmacy, your neighborhood pharmacy, and say you want to buy tretinoin. Unless you have a prescription, you can't get it. But in countries like ours that you can just get tretinoin anywhere, you can order online, you can walk into any pharmacy, they will sell tretinoin to you without a prescription, then you should be really careful, because one of the major reasons that tretinoin is a prescription-only drugs in countries like the US is because of the very severe effects it can have on the baby. So I will stay away from tretinoin when I am actively trying to get pregnant. Number 5, I will not ask my friends or any couple whatsoever why they don't have kids yet. According to statistics, 1 in 8 couples struggle with infertility. You never can tell what the couple is going through, what their struggles are. So your questions can come in as insensitive and can put unnecessary pressure on a couple. So it pays to be kind. Avoid asking couples when they are going to have kids. These are the 5 things I will never do as a fertility doctor. If you found this video informative, don't forget to like this video, share with your friends, drop a comment in the comment section, and see you in my next video.